Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. The NCDC gives a breakdown of home-based COVID-19 treatment, warns Nigerians against flouting rules. Edo State government reinvigorates the battle against coronavirus in the state, death toll at 136. And United Arab Emirates react to spike in coronavirus cases, tightens measures to save lives. In 24 hours, the NCDC reported new cases of 1,406 deaths. The new cases were reported in 25 states, including the FCT. Let's give you this week's breakdown of how fast the coronavirus is spreading in Nigeria. Now, this week alone, confirmed figures from Monday, January the 25th to last night, Nigeria has recorded a total of almost 6,000 cases. And those are the recorded numbers in just 4 days from the NCDC's data. What you might also notice from the figures is also the number of states and the newer local government areas that have confirming cases this second wave. When you look at the list of cases from January the 25th, which is on Monday, 19 states recorded cases on those days, 26 the next day of Tuesday, and 22 states were affected on Wednesday, while Thursday night, 25 states. For the total number of recoveries from Saturday till Wednesday, there was quite a number of states with community recoveries, and we crossed the 100,000 number of recoveries as well this week. If you also look at some of the states that are recording a higher number of community recoveries, you find Lagos mostly in all of the days this week. Kaduna also recorded some recoveries, community recoveries. So also did Plateau twice this week, and you have other states like River State, Kwara as well. And if we look at the international scene, especially with where vaccination that is ongoing, according to our World in Data vaccination statistics, you will find that the picture that shows the result of how research teams 12 months after the start of COVID-19 rose to the challenge and developed vaccines. There are 10 countries now vaccinating daily based on number of vaccinations per 100 people. And in some of those countries, you have Israel, 49.1, followed by the UAE, that's vaccinating as fast as UK in third place, and we have the US in fifth place, and you can see some of the other countries there as well. We understand that Hungary is one of the first countries in the EU to give preliminary approval to the Russian coronavirus vaccine, that's the Sputnik V. And today we heard Janssen saying that its one-dose COVID-19 vaccine has been 66% effective in a global trial. But we want to know what's happening in Africa. So how many countries are vaccinating on the continent? Statistics are showing that Guinea has got their first 25 doses, which they promised to frontline workers. Mauritius as well. Seychelles is also another country, Seychelles. Morocco saying that they're going to start this week. South Africa saying that it is starting its first doses February the 1st. So it's small. Just a small handful of African countries that we've seen that have started vaccinating their populations. But more information that we have is that the African Union has said that they have secured about 270 million doses. They've been secured, and realistically, that number should vaccinate between 10 to 15% of the continent this year. And the bulk that is expected is the COVAX, is the Oxford AstraZeneca vaccine. That's the bulk promised by COVAX and AVAT provisions as expected, followed by just a few million Pfizer-BioNTech jabs. Another thing that we're seeing this week, or that we've seen this week as well, is the variants that we've seen. The first detected variant in South Africa, the new COVID-19 variant, has also been detected now in 6 African countries, and according to the World Health Organization, 24 other countries outside the continent. With the Presidential Task Force confirming the UK variant in Nigeria, let's talk to an NCDC expert on what lies ahead as we fight the second wave. Dr. Olaolu Aderiola is the Incident Manager of the National COVID-19 Emergency Operations Center and joins us now. Welcome to the program.
Yeah, thank you so much for having me. Good evening.
All right, good evening. Is it too soon to talk about the numbers getting to the peak and coming down? What are the projections and how badly do you expect things to get worse before they get better?
Cases will definitely rise. In the last 21 days, we've had over 1,000 cases reported per day, and it's because people are not abiding with the non-pharmaceutical interventions that have been put in place, that is wearing face masks, avoiding crowded places, and washing their hands, using hand sanitizers. So those are the things that if the populace don't abide with these guidelines, then we will continue to have more cases, physical distancing and social distancing, they are not done. So definitely we'll have more cases. We're not too sure of when it will peak and when it will start coming down, but it depends on their collective efforts to ensure that we abide with the non-pharmaceutical interventions. But as it is now, the cases will still be high as we have now, and depends on the collective actions that we take. So we are doing everything possible, working with various stakeholders to ensure that this is done, and with the presidential signing of the COVID protection law, that may really help in enforcing the non-pharmaceutical interventions.
So when you say,
we continue.
I was going to ask that when you say things will really get worse, I mean, what's the number? Will you say we'll get cases up to 5,000? I mean, we're already seeing over 2,000 cases in a single day.
Well, that is a dicey question. It's also dependent on the number of tests that we get done. So we continue to ramp up the testing numbers that we have. And part of the thing is also to ensure that we really reduce the threshold of suspected cases and encourage more people to be tested so that we really know the burden that we have. We know currently in the country, quite a large number of persons are asymptomatic, are contacts. Some don't even know they have been in contact, been to a place where that has been infected. As we know, COVID, it's spread by is droplets, and if it drops on surfaces and are not cleaned effectively, and people touch their eyes, nose, and mouth, then they get infected and they may not know where they got it from. So these are the issues.
Was that also one of the reasons why the NCDC reviewed some of its guidelines, especially the case definition? Why did that happen? We know that you said a close contact of the confirmed case, irrespective of symptoms, will be identified as a suspect case.
Yeah, so the case definition is more or less a screening tool to help us able to identify persons who are likely to have been in contact with the SARS-CoV-2 virus, and there are stages in it. The suspect case, a probable case is somebody that probably died and we're not able to conduct a test. And once the test is done by PCR, that now moves to a confirmed case, and actions now need to be taken to ensure that they are treated. So the case definition we had before, looking at the symptoms that we've had in country, we've realized that the symptoms are now very diverse. Some people that have tested positive don't even have fever or cough. Some may just come down with loss of smell, loss of taste. Some may just be muscle weakness they have. So we have reviewed this so that if anybody just have two symptoms, then it's a suspected case eligible for testing. And once that the testing is done, we now know whether the person is confirmed or not. So we really need to test more people, and this really help our clinicians to be able to conduct the test more aggressively, and also for the populace to also ensure that once they have any of these symptoms, they get tested at any of the sample collection centers we have across the country.
All right, we'd like to appreciate your time, Dr. Adeolu Aderola, Incident Manager at the National COVID-19 Emergency Operations Center. Thank you for joining us on the program.
Thank you.
Now, the second batch of 424 Nigerian returnees deported from Saudi Arabia were protesting against the plan by the federal government to quarantine them. The Ministry of Foreign Affairs had indicated that upon return to the country, they will be quarantined at the FCT Hajj camp for a period of 14 days. Well, let's hear from our correspondent now, Emperor Simon, who joins us from Abuja.
At exactly 11:57 a.m., the Saudi Arabian airline conveying the second batch of returnees from Saudi Arabia touched the ground at the Nnamdi Azikiwe International Airport. We were initially told by officials from the Ministry of Foreign Affairs that 419 of them were profiled at the Nigerian embassy in Saudi Arabia. But later on, the manifest shown to journalists by an official from the airport shows that 424 of them were conveyed to Nigeria. On arrival, they were subjected to temperature check before being ushered into the arch terminal at the airport. After that, an official from the Ministry of Foreign Affairs explained to them what will be required of them in Nigeria and the need for them to behave themselves. Just after that, an official from the Presidential Task Force on COVID-19 started explaining to the returnees how they will be quarantined to ensure that they do not infect anyone should they be COVID-19 positive. And that was what led to the uproar as some of them started protesting, saying that they would not subject themselves to be quarantined. According to them, they were certified at the Kingdom of Saudi Arabia and there was no need for them again to be quarantined. Despite efforts by officials from the Ministry of Foreign Affairs to douse the tension, the returnees would not yield as they insisted that they wanted to go back home and they wanted that immediately. But the big question is, will the laws of Nigeria on COVID-19 be subverted because of the interest or the opinion being expressed by the returnees? That we're yet to know. Emperor Simon, Channels Television News.
Outside Nigeria, the UAE government has issued an updated list for fines for those failing to comply with COVID-19 safety regulations. The list issued by a state news agency re-released following the closure of an overcrowded restaurant in a cafe and an Abu Dhabi wedding. Now, this is as a surge in cases throughout the holidays into the new year is hitting a high. Our correspondent Maywa Adiguke brings us the latest.
Businesses across Dubai, UAE's leading tourist hub, are feeling varied impact of tightened COVID-19 rules following record-hitting daily infections in the wake of the festive Christmas and New Year holidays. Over 18,000 new infections have been recorded in the past week alone. In the new guidelines, restaurants are now to space tables 3 meters apart and reduce persons per table from 10 to 7.
The restaurants for the medium class like ours, it was deeply affected, and the result of the opening had no major effect, maybe 10%.
Candlelight's dining restaurant on the popular Sheikh Zayed Road is barely surviving, but the business next door shares a different story.
On the whole, and this is, I would take a positive take on this. On the whole, we've seen an increase in sales because we've always been a delivery-centric brand. It's extremely different for the, if you see the restaurant industry on the whole.
Before the announcement last week, up to 200 people were allowed at social gatherings such as weddings. That number has now been cut down to 10, while hotels and restaurants have been ordered to cancel all entertainment.
It doesn't actually apply, from our understanding, to other events that are happening, whether that be community events or cultural events. However, many clients and many people we're working with don't actually understand what the rules are applicable for. So I think there's been a lot of blanket panic over the last week in particular, and we've seen many things cancel because people are just unsure about the rules. So I do think there needs to be a bit of clarification in terms of what this rule is applicable for and why. And then at least people can make a judgment and can start planning, or can start even producing and delivering events where this rule is not applicable.
Some business owners are disgruntled as they believe they are now paying the price for the city opening up to tourists.
That was good for businesses. Did that lead to an escalation of cases? Of course it did. It's part of the process, right? We've all got to accept the reality. We are in the pandemic and this will happen. But is the government taking the right measures to curtail the rates, have enough vaccination out there for everyone, do enough testing for everybody? Yes, by all means. And I think that's the positive sign.
In a social media publication, the federal authority explains its pandemic strategy as a balance between maintaining the safety of the community, restoring normalcy, resuming economic activities, and accelerating producing on various vital sectors. Part of that strategy is its free vaccination program. Government plans to have half its population vaccinated by first quarter 2021. From Dubai in the UAE, Mayawa Adigoke for Channels Television News.
Well, a doctor joins us from Dubai very shortly when we return for more on the COVID-19 second wave in the UAE. For more on the situation in the UAE, we have Dr. John Oluwole. He is a specialist neurologist at King's Hospital London in Dubai. Thank you for joining us on the program.
Thank you so much for having me. Good evening.
All right. First, tell us, how have you been affected by the renewed tightened COVID-19 rules following the spike in cases?
Well, I think every sector of life here in Dubai is affected. First of all, I would say that we never really had complete relaxation of the even cases went down. Face masks were still enforced, and places of worship were never allowed to open. And then schools and in restaurants, there are minimum distances that must be observed between people. But nowadays, in the last, let's say in the last couple of weeks, we've seen the number of cases rising exponentially. And so new measures have been introduced, like in the hospitals, for instance, we cannot have some of the elective operations and surgeries anymore. We're having to dedicate more and more of our facilities to COVID care. And that affects a lot of hospitals. So gradually we're getting higher numbers of cases of COVID-19 coming in, some being critically ill. So we're having to repurpose a lot of our services towards COVID-19 care right now. So much of the services, other services are being suspended.
Would you say that the people there are adhering to the non-pharmaceutical protocols, that they're taking it seriously?
Well, that's a major problem, actually. I think this is something we've observed everywhere in the world. Initially, when the pandemic started, people took it very seriously. But then the human nature, it's very, very difficult to enforce or to comply with things. And people when the numbers started going down, people were beginning to party. They were beginning to observe less and less social distancing. People were crowding and not wearing their face masks properly. So all these things are part of the problems we have. And this is part of the things that are responsible for the escalation in cases right now.
We understand that the UAE is doing quite well, second after Israel, in terms of its vaccination per population. Have you taken your vaccine? Because, I'd like to believe that they are prioritizing health workers.
No, certainly the senior citizens and the health workers were prioritized. And so we're having to register, and then when it gets to your turn, you're invited to come have the vaccine. But at the moment, we've got the Pfizer-BioNTech vaccine, then we've got the Sinopharm. So there are outlets, several outlets in the country where people can actually walk in and get vaccinated. So for the Chinese vaccine, it's pretty open to all residents, and people have been encouraged to get vaccinated. So some companies are also sponsoring these vaccines at their own level. for their staff. So the campaign is going on pretty well here, and I think currently we're probably just behind Israel in terms of the coverage of vaccination at the moment.
We're also hearing that the government is saying the vaccination will be done annually. What exactly does that mean?
Well, I think it's still too early to say for sure, because we don't know yet how long the immunity is going to last against COVID infection. Studies are beginning to emerge showing that probably after 3 months, the antibody levels begin to drop gradually. So we don't know yet. I mean, studies are still going on to see how long will the protection last. And again, we don't know how long this virus is going to stay with us. So for now, it's still too early to say, but then there's that possibility that we might have to be vaccinating periodically if this virus stays.
About 3 days ago, there was an advert for more nurses, especially nurses working in ICU units by the government. How badly are medical workers affected there?
Well, certainly a lot of workers are getting positive. People, because the truth is a lot of patients coming into the hospital for some of the reasons might be asymptomatic and we get exposed to them. So the aftermath is every now and then workers, doctors, nurses are developing symptoms and having to isolate. So the number of workers available to care for patients is reducing. And again, like I said before, the number of cases are really rising, cases needing critical care in the hospitals. So in a bid to make sure that there's adequate provision for the rising number of cases, that's why the government is advertising to make sure that there's adequate provision in case it becomes very necessary to, the number of cases needing critical care becomes overwhelming, like we had in March. We're afraid actually that probably we're heading towards where we started from. But then with the vaccination campaign, we're very positive that we'll be able to mitigate the process.
We appreciate your time. Dr. John Oluwole, a specialist urologist at King's Hospital London, Dubai. Thank you for joining us and please stay safe.
Thank you so much. Stay safe. Thanks for having me. Bye.
Meanwhile, a single-dose COVID-19 vaccine developed by Janssen is said to be 66% effective, but nobody needed hospital treatment or died from the coronavirus after the vaccine took effect in the international trial. Crucially, the trial looked at giving just 1 dose of the vaccine, which makes it significantly easier to roll out than those requiring 2. Here's more on this and other developments on our COVID-19 Global Update.
The UK has pre-ordered 30 million doses from Janssen's vaccine, which is set to prevent 66% of COVID cases after a single dose. But the jab is awaiting approval from the UK regulator if approved. Health Secretary Matt Hancock says the single-dose vaccine will significantly bolster the UK's vaccine program. A separate new coronavirus vaccine named Novavax has been shown to be 89.3% effective in large-scale UK trials. The Novavax jab is said to be the first to show in trials it is effective against a new virus variant found in the UK. But the head of the South African government's COVID-19 advisory panel has expressed concern at the vaccine's reduced efficacy against the new South African strain. Sri Lanka kicked off coronavirus inoculations for frontline health workers today, 24 hours after 500,000 doses of the vaccine were donated by neighboring India. United Nations Secretary General Antonio Guterres received his first dose of the COVID-19 vaccine late on Thursday. He said he felt very grateful and urged everyone to get vaccinated as soon as they can.
I'm very grateful to the city of New York and to this wonderful staff here in Adlai Stevenson School in Bronx for the vaccine I just got. And to say how important it is for everybody everywhere to be vaccinated. And my appeal is for all to take profit of the opportunities that exist and be vaccinated as soon as they can. And I want to express my gratitude to the City of New York for having included the UN staff and UN diplomats in their vaccination program.
In other developments, Portugal has tightened its coronavirus lockdown, banning all non-essential travel abroad and hiring foreign medics as hospitals struggle and deaths reach record highs. The country's pandemic death rate is now the highest in the EU.
Continue to take responsibility. Visit our website. It's channelstv.com for more updates, a better understanding of the pandemic, plus you find several other stories all at your fingertips. That's the program for the week. Thank you for watching. I'm Millicent Walker. Stay healthy, stay safe.